This film is an invitation to health professionals to refer older people affected by cancer to a new support service provided by independent peer advocates. This service has been developed by Macmillan Cancer Support and the Older People's Advocacy Alliance.
For us it's been very positive. I mean, I think our patients so far that we have been able to refer and give the information about the advocacy service have found it hugely beneficial. It's not, people haven't always had access, to these additional support services. So for us it has been a very positive thing, and I know that our patients have had, they've really benefited from it. Maybe not on all different levels actually. Sometimes it's practical help, sometimes it's psychological help, sometimes it's just signposting in the way perhaps of even financial support. All of these things are important when you're trying to cope with a diagnosis and sort of as you move forward. So certainly from my point of view, I think all of us has been
from patients.
very positive.
Yeah, the patients really seem to think that the service is working well.
The role of the peer advocate is to support the person in both clinical and community settings. Peer advocates help older people affected by cancer to make many different decisions, whether it be about cancer treatment, housing or finances, and they help with anything else the older person affected by cancer needs support with, such as being supported at appointments.
There are many, many conversations through that treatment that you can't possibly have with the people that are closest to you. You need somebody in your life that you can say all the things that need to be said that you can't say. Advocacy gives you that, and it is the only thing that gives you that. The medical people will take care of your health. They will do everything they can, but an advocate will provide you with that person that you may not be able to find. Not everybody's got them. And even your friends love you, and you can't have those conversations. Believe me, I know.
Advocacy for older people affected by cancer is free and confidential and is independent of health and social care services. Advocates only act for the person they are supporting and only with their full knowledge and consent. They help them to say what they want, secure their rights, represent their own interests, and access the services they need. And, importantly, advocates provide emotional support at this most testing of times.
Imagining this service that we'd really like to grow, this health and social integrated service that sits around a patient, with them in the centre and lots of people around them, me included as the GP, just going forward to this new NHS idea of helping people with long-term conditions. So again, you've got the patient in the centre and they've got a house of care structured around them. So you've got your commissioning as the foundation, you've got patient information as a pillar, you've got all the healthcare professionals as another pillar, and then you've got all the services available on the roof. And yet again, I think there needs to be somebody in the house with that patient, just having a cup of tea with them, explaining to them how to navigate through keeping their house healthy. And if you are alone, then an advocate is the ideal person to do that.
Peer advocates are uniquely placed to support older people affected by cancer. Most of the peer advocates are volunteers. They are older and have themselves been affected by cancer. They are carefully recruited, trained, and then supervised and supported in their role. Jenny, a volunteer coordinator, explains why the service is specifically targeted at older people.
I think older people affected by cancer are particularly in need of advocacy because it can be a particularly difficult time when you're faced with a cancer diagnosis or you're supporting someone who's recently being diagnosed. But it can be a terrible shock to the system, but also you're having to deal with so many different things, so many different systems, so many different processes, and not having the time or the energy to deal with it, as well as all the personal and emotional impacts. So having that independent person to help you really digest what's going on and to come up with some kind of solutions together can be really helpful.
Yeah, I want to cope without you. It's definite that, you know what I mean? I know I wouldn't have done. I get stressed out with paperwork, and you've helped me out with all that as well, and been there for me at my meetings at the hospital and everything, which has been reassuring knowing I wasn't going on my own and I weren't having to face it on my own, because I've no one else, you know.
Cancer treatment, as we all recognise, is completely daunting. You have various appointments in various places, and for our patients they have to travel to Poole for their radiotherapy. So just a catalogue of appointments, and people with slight memory loss or older people, that getting there, the knowing when the appointment is, knowing where you're going, can be very, very confusing, and quite often patients have missed appointments, not because they haven't wanted to go, but because they've got confused about where they're meant to be and what they're meant to be doing at that particular time. So advocates play a real important role in helping somebody, just reminding them where they need to be and what they need to be doing, and also what they're going for.
At the appointment, of course, there is a lot of information to take in and difficult choices to be made. Here, the peer advocate provides invaluable service, as Katie and Anne, breast nurse specialists, explain.
I think there's a lot of decisions patients have to make, and we try and help them as much as we can, but sometimes I think to have someone actually one-to-one at home with them, to have a lot of time to go through these options, read the information. There's a lot of written information that we give, and it's having that extra time, isn't it?
And if you've got someone that can come to clinic with you and listen, it's another pair of ears. You don't take everything in when you're seen in clinic. It's having just someone else to come along, and we know that a lot of information we give isn't taken in in clinic. That's why we sort of give some written backup, but having just someone else with you who has listened in is really important.
So these are some of the benefits that peer advocacy provides for older people affected by cancer. And the involvement of peer advocates has positive benefits for health professionals too, as Jagtar Danda, Head of Inclusion at Macmillan, explains.
So I think what an advocate can do to support the healthcare system and healthcare professionals, such as a Macmillan nurse, is that they can add that additional value in terms of providing a range of additional support and signposting to things outside of just the clinical focus. So they can start to signpost to emotional support, they can signpost to practical ways in which people can deal with the challenges of having to live with the impact of cancer. And I think a lot of that can happen inside and outside of those clinical settings. And when they are looking at outside those clinical settings, often the CNS or professionals aren't in that place. So I guess the advocate can be with a person in their place of choosing to support them in a context that is much broader than just what happens within clinical focus.
Health professionals' time are limited, and there are many people that they need to help. What our volunteer advocates have is time, and our whole volunteer advocate team is supervised and managed by a paid advocate. She supports them and she leverages all that free time that the volunteers give, and there's an enormous cost benefit in that.
Yes, advocates do save me time, because before, where I'll be phoning a patient to find out if they're all right or getting on, I can liaise with the advocate and I can say to the advocate, if there's a problem or if you notice something or if they tell you something, please can you feed it back to me? And that way, and definitely with email correspondence as well, I correspond quite closely with advocates via the email, and that way I can keep them up to date clinically on what I feel they need to know, and also they can feed back to me on where a patient is and how they're getting on with things.
And do you think there are benefits to your practice? Do you think advocacy can save you time, money?
Without a doubt. So much of what we do is not what we're trained to do. So you go through medical school, you learn about how to be a doctor. Yes, of course your patients appreciate the fact that they're coming to see an expert, that they can present their symptoms, and someone with a little bit of knowledge who's kept themselves up to date will work out what's wrong with them and hopefully make them better. But in amongst that whole process of examination and referral, there's the practicalities, the real day-to-day, arranging the appointment, getting to the appointment, having some support at the appointment, coping with the information you are then given, somehow working through making a decision that you might have to make or a choice that's given to you. The practicalities of that can be overwhelming.
So would you recommend anybody else with cancer to ask for an advocate?
Yes, I would. Yes, I would. Yes, I would. Because not only that, it will protect them through their times of breast cancer, and also they won't be alone at that time, in their times of need.
Breast cancer is one of the most common cancers. We have a lot of patients who access our services, and as we move forward, the numbers are going to continue to rise. And so advocates are going to be key in helping to support professionals to provide additional services for our patients in the years ahead.
So obviously you would recommend other health professionals to refer people.
Absolutely, I would promote an advocacy service and I would ask other GPs to use it. I see it making not just the patient's life better, but hopefully making their cancer journey easier and surely improving the role we need to play, making it easier even.
Yes, I definitely do refer patients to the advocacy services, and I intend to carry on doing so.
We hope that you will refer older people affected by cancer to this service. Referrals can be made through your local advocacy organisation, and people can self-refer. For more information and the contact details of your local advocacy service, please see the About Us page on www.opalcopa.org.uk.